Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Harvey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday on the Harvey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 10th of May. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. The leading discussion today is myself, Sophie Bukowski, who's a student research assistant at the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics. We are seeing some very unfortunate numbers going on right now. Our current 7-day average in the United States is hitting about 73,000 positive cases. And yesterday in the States, we saw 110 new cases. The booster shot rate is still hitting about 30% in the United States, and both hospitalization and deaths have increased pretty exponentially. In Illinois yesterday, we saw 14,449 positive new cases, while cases are going up 64%, and hospitalization and deaths are both increasing. What can you tell us about what the heck is going on in places like Illinois that are peaking at 14,000 new cases yesterday?
This thing is everywhere, and we are, as we said a couple weeks ago, and I think I was the first one that said publicly, this is the sixth wave. We are in the sixth wave because these cases are still underreported because many cases are diagnosed on the home antigen tests, which do not get reported and included in the statistics. So that said, the hospitalization is real. That's a very real number because the hospital tests everybody with a molecular test when they come in, so they pick up all those people. And of course, the death rate is real. People have to have something on their death certificate. And since everybody comes in the hospital and gets a test, they know how many people have died with COVID. And you can break it down to dying primarily of COVID or COVID was in the background. That said, these numbers, the death numbers are really, relatively low. 329 in the United States. My analogy I use is, one plane crash a day. I mean, that's still too many, but compared to what it had been in the past, many thousands per day, this is a relatively low number. And the numbers in Illinois is only about 10. I think the average is 9. So, if you have 3 extra cases, you see this, 30% increase. Well, 30% from 10. So, you can't go so much by the percentage increase or change, especially by the day. So we have to look at we're going to be looking at the absolute numbers a lot more for deaths. And we can look at percentage changes in numbers and hospitalization. So, really that's what's going on. But we're in the sixth wave now. There's no doubt about that.
Yeah, that's really unfortunate. And that ties, right into our first headline, which is the vanishing variants, lessons from Gamma, Lambda, and Mu. What can you tell us about these 3 variants that were such a big deal at one point and then vanished completely?
Well, in different parts of the world, variants are popping up. And, variants can be very bad. Delta was bad, and that became worldwide. Omicron was bad, and that, of course, is worldwide and still going on and still turning into different subvariants. However, in some places, Gamma, Lambda, Mu, they showed up. Everybody was worried about them. Is that coming here? They actually just got outcompeted with the virus that was here. So they didn't take over worldwide. They were really limited to very specific regions in the world. And they just vanish. They just go out of existence because they're outcompeted by the circulating variant worldwide. So, every variant is not going to take over. It's going to have to fight to take over. So the strongest wins, and in the case of COVID, it's the one that can transmit the fastest and cause the most damage.
Yeah, no, absolutely. And now for our second headline. So CPS has now extended remote learning for kids who are at risk. This is an incredibly good option for a lot of individuals who have families that are at risk or themselves. What can you tell us about this access to remote learning?
Yeah, I think this is a great example of how we're going to live with COVID for the foreseeable future, and that certain people are really going to have to try hard to avoid getting infected because they're at high risk for serious disease and death. And so kids at very high risk, this is a really good option. And I think we should encourage this in all sorts of situations, especially the elderly. They have got to really be careful. 75% of the deaths are people over 65 years of age, approximately. So older people with underlying immunocompromising diseases, people that are overweight, they've got a recent cancer history, or they've got heart disease. I mean, diabetes, we've gone over the risk factors many times, they're very well known. People that are in those high risk categories have to be much more careful than the general public. The general public has pretty much given up on trying to control this. Now, this is going to wax and wane as these peaks come and go. And right now we're zooming up the peak, and cities like Philadelphia, high-risk kids in Chicago schools, other groups are starting to put in place the mitigations that we know work, which is masks, social distancing, and most importantly, keeping up on the vaccines, because they will protect you from serious disease.
Yeah, absolutely. And going into our third and next big COVID headline, the US is going to limit next generation COVID vaccines to high risk people this fall if Congress doesn't approve more funding. What can you tell us about this funding that Congress has to approve for access to everyone getting the vaccine?
This is a very important story because in the fall, we are likely to have from the major vaccine companies, and there may be more, like Novavax may be finally approved, so they're going to be included in the game now, and other vaccines as well. But Moderna and Pfizer in particular have a second generation vaccine that they're testing right now. We're assuming it's going to work better. Like with flu, you don't take the same flu shot every year. You take a different one that's working for the variant of that's likely to hit the country. That's a guessing game as well. So anyway, if they don't purchase enough vaccines, and people assuming they're going to take the second generation, I know a lot of people, they ask this question every week, should I wait for the second version of the vaccine? I tell them no, because we don't know when these are going to get approved. And right now we're going up. We're going in on the uphill part of the peak. So don't wait. It'll be too late. You're going to get it, and you could get quite ill. So if Congress limits the funding for the distribution of these vaccines, up until now, they bought every vaccine that people have taken. Hundreds of millions of doses have been given in the United States, either as the first 2 shots or the booster, one of the first or second booster. All that's been paid for by the US government, by your taxes. If that stops, they'll come up with some funds to vaccinate people. They'll buy somehow, but it'll be limited. And it won't be enough for everyone. And so then they're going to limit it to the most high-risk people. So some would say, oh, well, this is really good. I mean, that's okay. Well, if that's the best you can do, that's what you can do. But what about the people that get very sick from COVID? Nobody wants to have COVID. This is a very weird disease. We know at least 14% of people go on to get long COVID, including people who had asymptomatic disease in the first place. So, you don't want to get long COVID. You don't want to get COVID. Believe me, you can get quite ill with COVID, even if you're not at high risk for getting hospitalized. So that's this would be really sad if it comes to this, because what that will mean is you're going to have a veering off between the high-risk people or people with money who will go out there and maybe they'll buy it, and the poor people who are poorer people who just are not going to be able to afford this vaccine. This is not a cheap vaccine. And so if as soon as you start making it between people with money versus people that don't have enough money, this is a public health catastrophe. And then you'll have pools of people who don't have a lot of money that are going to keep the pandemic going. So this is not a very smart move by the U.S. government, because the pandemic is not going away for now.
Right. No, absolutely. Now going into our first COVID question. How worried should we be in the United States with BA4 and BA5 variants, and how are they going to affect us? And do you have any idea of when?
Yeah. So BA1, this variant that started floating around worldwide, was I first identified anyway in South Africa, there's been some subvariants of that, and that has outcompeted everything. And so the South Africans also have identified BA4 and BA5 at Stellenbosch University, which Northwestern has a very good working relationship with. And matter of fact, we're having a meeting down there in 2 weeks. It's not about this, but it's about training junior investigators to be good academics, both from low and middle income countries and from the US that want to work globally. So anyway, that project, we're going down there and I'll be broadcasting from there during this. So we'll have some firsthand information. Maybe we can even interview one of the key professors down there, one of the workers in the area. They have a very unique situation in South Africa. And we have to be worried because these things are outcompeting the next one. Let's go back to highlight how this works. At the end of last summer and the beginning of the fall, Delta came in when we weren't supposed to be having a peak because it was still the summer, but it was so contagious, it took over. And it was actually a more serious infection. Then Delta was going into the Christmas holiday season, and we almost always have a peak after the Christmas holidays. So far, anyway, in the years we've been following this. And then we had Omicron peak on top of Delta because it outcompeted Delta. It was 3 to 6 times more likely. That's 300 to 600% more likely to transmit. And then all these subvariants increase the transmission even further. That's why you're seeing so many cases now. They're just flying all over the place because this thing is so contagious. It's 25% more than the last one. And we'll see about BA4 and 5, but it doesn't look good because it looks like that thing's a very healthy variant. And we'll find more out about that. And maybe even some in-person interviews when we're down in South Africa. So we have to be worried, and it's going to affect us just like all the other variants.
Well, that's really unfortunate to hear. And now, for our second question, going into the warmer weather, especially in Chicago, as we're seeing a nice warm week, how worried should we be about outdoor events as the weather gets warmer and as variants become more contagious? What can you tell us about this?
Well, it's become so contagious, these newer variants, that, we said, before, you can be outside, there's hardly any transmission outside. And that was the very first thing we learned from last summer. Well, of course, don't forget what happened in last summer, Delta. Even though it was summertime, we had the big wave then. So the outdoor events are also going to be risky. So that means that the people that are at high risk now have to avoid outdoor activities because of it's so contagious now, even in the outdoor setting, like these big concerts, these huge events that were out there cause all sorts of many little epidemics to pop up afterwards. These music festivals and everything, and everybody wants to be outside. They want to feel safe. And of course, the key thing is now nobody's wearing a mask. So, and nobody is requiring vaccination before you go in. Remember Lollapalooza? You had to be vaccinated, remember? And then you had to, or have a test just before to get in. They didn't have anything bad happen at that thing. So that was, pre-Delta. Cases were down, and they had some mitigations in place and nothing happened. What if there's no mitigations in place? And this thing is so much more transmissible than the virus that was floating around back then. Basically, every kind of event is going to get it. And some people even project that coming at the end of the summer, probably 100 million people are going to be getting infected. These numbers are going to go through the roof.
Wow.
And so we've really, really got to be careful. This is how epidemics work. Those people will get some immunity from it, but they're going to have a lot of sick people, and the people at risk, you're going to see the hospitalizations go up. And it's not going to be just all unvaccinated people. That's kind of flipping around now, because a lot of the unvaccinated people got Omicron at the beginning. They paid their dues with that, so they've got some immunity. But this is a sneaky virus, and that immunity does wane over time. And after a few months, you become very much at risk for getting infected again. For instance, with Delta to Omicron, people got Delta. I had patients, they had got Delta in December, and in January they got Omicron. They had almost no protection from Delta. So we've got to be really, really careful. We have to be, in other words, it was a very long answer, very windy answer, but with these current variants, they're so transmissible that even outdoor events, you have to be careful.
Well, thank you so much, Dr. Murphy. Those were all of our COVID questions for today.
Well, great. And we'll talk again on Friday.
On Friday.
I'm going to be traveling on Thursday, and we will again talk on Friday. So
wonderful. Thanks so much, Dr. Murphy.